What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering, is being the X-ray tech the right career / medical field for you? So to give you context, I am an A-shift X-ray tech. I've been doing it for about 4 years. Work ungodly amount of overtime, days, nights. So I've been in the emergency room since I got out of school and pretty well versed. Talk to many people in other medical fields. My lady's a nurse, so I have a glimpse of all the other fields. So you're here because you want to know about the X-ray tech world and is it the right choice for me? So some of the questions you have to ask yourself is, how much patient care time or assisting other people do you want to be involved with? If you want to be like my lady, who's a nurse, and get 100% of all the credits, taking care of people, giving medications, doing other bodily fluids, cleaning up, and doing majority of the work, X-ray tech's not for you. We are the people who see what's wrong but really can't do much unless you're in the main doing fluoroscopy. We are the people who don't get as much credit, but we are a little tool in the toolbox of the doctors. That tiny thing that helps them diagnose and lets them know what's going on inside and out. So some of the things you have to understand is, especially if you work in the emergency room like I do, you will see broken bones. Now, I know some people like Miguel, if something's broken, okay, it's fine. Like, they can't move, there will be a time where people's bones break and it's sticking out and you can literally see the anatomy. You can see the bones, you can see everything you read in your A&P books. You can see all the bones, the ligament, and all the stuff. So you can't be squeamish with blood, other bodily fluids, because that will come into play. Now, I know you're saying, like, Miguel, I'm not going to work in the emergency room. I'm going to work in the main radiology. Well, you have to deal with enemas, and you still have to deal with bodily fluids. Now, the enema, which for some people who do not know, is essentially when you grab a little tip and you put it up someone's butt and you inject either air, contrast, or both, and essentially you can see what's obstruction and you can see inside of their intestines, and that exam is performed with a radiologist or a RPA. You will still be involved with bodily fluids. Now, for some people, they're like, Miguel, I can't do that. I don't want to do that. And my question is, if you still want to be X-ray tech, but you don't want to be involved with the fluoro stuff, you can do what I do. At night shift, we're like Germex. It's 99.9% chance that you won't do fluoroscopy, but it's never zero. There's always that tiny percent that someone can come into the emergency room. It all depends on what level of trauma. If you're probably trauma 1 and 2, I can't make you that promise that you won't have to do fluoroscopy, because those people get the more severe and stuff. 3 and 4 level traumas, probably not. They'll probably wait till the morning, or they'll ship them off if they're really bad. Us, the only time we would have to do a fluoroscopy exam is if I've done an esophagram overnight. I've done a cysto overnight. And those were both because the patient was young and they had something very traumatic happen to them. And for them to get assistance from the nurse and the doctor, they had to make sure that their body was functioning or be able to take catheters and tubes. And yeah, it's only twice in my 4 years of working have I had to do a fluoroscopy overnight. So there's that. Majority of the times you will be split up depending, like, let's say you work in the hospital like I do, you wish to work. There's 3 different teams. Some have 2 teams. Essentially, you can be in the ER and that's where you are in the ER / the whole hospital, the NICU, the ICU, doing portables and taking care of the ER. And then you have the main radiology. The main radiology involves all the inpatients / outpatients, people that are getting cystograms, they're getting their hip injections, they're getting tubes replaced, stuff like that. Kind of structured into little blocks of hours, and majority of the times it'll be done with the RPA / radiologist, depending on what's going on. Those are the typical Monday through Friday, 8 to 5, 8 to 4 type of shifts. Right there, ER's more 12s. Sometimes it can be broken down a little bit less depending on what days it is. And then the other part of the hospital we have is the patient outbuilding. Those are usually patients who come in that maybe their primary care physicians ordered like a chest X-ray, or for pre-op, or for like any of the orthopedic doctors that they want something done. They could come to our hospital and get it done. A bunch of chest X-rays, some knees, some spines, some post-op type of exams. Majority of the times it is just X-rays. Our hospital where we work at, the machine broke down, so we quit doing any fluoroscopy exams over there. It could be different depending on where you work at, but that's just my situation. Just know, wherever you go in this beautiful field of radiology, your machines, unless the hospital is new, majority of the time you will not be working with new equipment. The majority of your equipment is holding on by Jesus Christ, and they're kind of like 5 years old, and they will do everything but patch it up and try. Just know that, because I know you're like, Miguel, surely somewhere else has better equipment. I've talked to people in trauma 1s, I've talked to people in trauma 2s, and the higher ups, and they all tell me the same thing. I'm like, oh, because like I had a situation where I had to go to some of these hospitals because of my family, and they've gotten X-rays done, and I've talked to some of the techs. I was like, yo, what kind of year is your portable machine, or what's, I just chat with them to get some information, and they all tell me the same thing. And then I'm like, this problem's universal everywhere. And you would expect the top tier level 1s, level 2s to have the best stuff, because they're dealing with the more wild, high, tense, same boat. So just know that, regardless of wherever you go, because our equipment costs a lot of money, you will have to deal with. And I would say, if you're a nurse, you don't have to deal with that. My lady's a nurse, deals with the same stuff over there. So can't really escape it in any of the fields you do. It's just something that I don't know. But continuing on, it's a good field. I've always enjoyed it. I don't complain about it. I genuinely like this. Like, every single time I get to go to work, I'm actually happy, because I know that I get to look at bones. And if you check out my profile picture, it's a little Jurassic Park logo. I love bones. Now, if this was someone else, a lot of people in this field don't like their job. Some people have been doing it too long. They're just tired of, especially in the ER, majority of the times you're doing chest X-rays 80% of the time. 1 views, probably 50, and then 2 views thrown into it, and the rest will be extremities and spines. That's and nasty feats. Just wounds. Mima, who broke her hip because she fell because of cookies. Mima, like a dog tripped her. You'll see everything in this field. I personally enjoy it because I've worked other jobs and I have family members who work other jobs that they literally, when they go to work, very physically demanding. Well, this job is too, when you're trying to place the board, but like at nighttime, let me not say this too loud, because the people might hear me. Sometimes you can be chilling. Can't confirm nor deny naps or other devices at night times. But yeah, nighttime is quite a blessing if you're able to work it. I have kids and it helps out a lot. But it's not that bad. You'll hear people and they'll complain about stuff. They'll complain about it. And I'm like, I look at it and I understand where they're coming from. But I'm like, you're just kind of being petty. You just kind of complaining just to complain. Because you want to, it's a normal thing, I guess, in our society to complain about your job. But like, I think about it and I look at it. Or maybe it's perspective of because they never worked other jobs or they don't have family members, so they don't see like other jobs that where you clock in and you're working the whole time. In daytime, yeah, maybe you are working a little bit more, probably like 80% of the time, versus night it's like 50-50. Especially during the winter season, yeah, it might rev up and you'll have a lot more patients coming in the workflow. There was a time where literally at the beginning of my career, for like a good 6 to 8 months, I ain't do nothing. I ain't do nothing. Literally, we would sit there. You were getting paid to literally sit there for hours, just watching the screen and making sure nothing pops up. Obviously now over time it's kind of ramped up and stuff like that, and it's not as golden or goated as it used to be, but like it was wild. I talked to other people and it's amazing what night shift can be if you're fortunate enough. Sometimes it comes up to literally the physicians who are working, and today from the looks of it I'm gonna be working hard because I see who's working with me as the physician. I have to do a lot of exams, but even then it isn't too bad. Now some of the patients it could be a little bit hard because when stuff gets broken, and I mean like truly broken, and you try to take that first picture or just try to get that board under them and they start screaming and hollering after they've gotten all the drugs, and you shoot it and you see how bad it is, you just got to be like, okay, so we'll have to cross table, we'll have to do this, we'll have to do that. And sometimes you have to almost be, and like in the trauma rooms when something major happens and the patient's yelling and there's like so many people in the room and it's one of those Grey's Anatomy shows, people hitting the fan and everyone's like looking, just running around, and you're just there. You got to lock in and do your job. It's almost robotic. One of the students who worked with me one of the days, something happened with one of the patients. He was yelling, screaming, there was so much going on, and I had a student with me and they were like, Miguel, I don't know how you do it, because I was just so focused on the patient and everything, I couldn't focus on getting the X-ray done, and I'm sorry for not being able to perform and get the comp. And I was like, it's no worries. It's like you were like so robotic and you just like locked in and focused and just did what you had to do for the doctor. And I'm like, yeah, sometimes the patient will be saying all this, screaming, hollering, maybe they're not in the right mind, maybe stuff going on, but the doctor needs this X-ray so he can diagnose their broken or their pneumo or whatever going on, and you have to get this picture done. And sometimes you almost have to cut out your feelings or your emotions. Sometimes it's something that over time you will kind of develop. But obviously you do have heart, because sometimes like you'll see someone and you're like, damn, that you're pretty messed up like that. I feel bad for you, because you'll see some of the wild stuff. But overall, this profession has been good to me, and every time I look at other people who are in different professions out here in the medical world, I was like, I don't know if I could do it, or if I could do it, I wouldn't be as happy, and I wouldn't be I would not pull as much overtime. I would not. I would be miserable. And this is coming from someone whose lady's a nurse, and I see how she does and how she talks about her profession, which mad respect to them, because I couldn't be a nurse, and I see what they do even at work. But that's not me deterring you from being a nurse, and that's what, if you want to do that, go ahead. I respect you, because they have so much stuff going on over there. A lot of jobs. And I know, as far as job opportunities, the X-ray field, here, trauma 3, ER, and night, only 2 techs. 2 on my rotation, 2 on the other rotation. I could see how that would be hard to get a job. And when you have someone like me who sees how easy the job is, unless I get fired, I ain't going nowhere. Why? I have everything. I got a system down. I have a good coworker. Certain positions would be very hard to get into like that. Now, daytime, we have 3 to 4 on every rotation. We probably run 2 rotations, so there's more opportunity. But I could see how, if you work somewhere in a smaller place, how it'd be harder to get jobs. The good jobs that people don't leave until they retire or they have to move. So I was fortunate enough to get one of those, and I thought it was just an okay job until I started talking to my coworker who's worked several jobs, and she constantly telling me, Miguel, your job you got right here, it's pretty good. And I say that worth a bunch of other years of working other places. And I talked to the techs who are veterans who've done this for 20 plus years, who's been working here since film, and they literally tell me the same thing. They're like, Miguel, I worked at all these other hospitals nearby. It's the best one. If I were you, just stay here. And I was like, you know what? Take your word for it, man, because I just be looking at other places, and I'm like, I don't know if I would be happier. It's been your boy Miguel. I gotta go push the button. See you in the next one.